Thanks for joining. We're going to get started now. Today we have Dr. Moore here, so I'll turn it over to him for some brief remarks.
Good afternoon. Bon après-midi à tous. It's been a little over 2 years since Ontario reported its first case of COVID-19. And in these 2 years, we have fought to reduce transmission of this virus and minimize its severe outcomes, such as hospitalization and death. We have seen the way we live, work, and socialize change. The public health measures that have been implemented have been necessary and have saved lives, and they have come at a cost to our mental health, our well-being, and our livelihoods. I want to thank Ontarians for their sacrifices. I know it has not been easy. Les mesures de santé publique mises en œuvre ont été nécessaires et ont sauvé des vies, mais elles représentent de grands coûts sur le plan de notre santé mentale, notre bien-être et nos moyens de subsistance. Je remercie la population ontarienne des sacrifices qui ont été faits. Je sais que cela n'a pas été facile. While we know COVID-19 is not going away, we are in a very different place than we were 2 years ago. We have greater knowledge and experience in how this virus behaves and what works to stop its transmission. We have tools that we have not had before. We have highly effective vaccines that have changed the course of this pandemic, and we have effective treatments for those at risk of getting very sick. Our vaccination rates are amongst the best in the world, with over 90% of Ontarians aged 12 and over with 2 doses. We continue to make progress in our vaccination campaign. For our 5 to 11-year-olds, 54% have 1 dose and over 24% have 2 doses. And over 6.7 million Ontarians have received their booster dose. Many of you heard the call for arms. By rolling up your sleeves, you have not only protected yourselves from serious illness and hospitalization, you have also helped our dedicated frontline healthcare providers by reducing the burden on our healthcare system. While the risk remains, this commitment has paid off and means that we can continue to ease some of the public health restrictions today and again on March 1st. En vous faisant vacciner, non seulement vous vous êtes protégé de maladies graves et de hospitalisation, mais vous avez aussi aidé les fournisseurs de soins de première ligne qui continuent de se dévorer en réduisant le fardeau sur notre système de la santé. Bien que les risques soient toujours là, votre engagement a porté fruit et nous pouvons maintenant continuer à assouplir quelques restrictions sanitaires aujourd'hui et encore le 1er mars. Easing measures allows our society to start enjoying the things that improve our well-being, but it also means continuing with Ontario's staged, phased, cautious, and evidence-based approach. This includes keeping our masks on a while longer and that health and safety plans are in place to keep public spaces safe for all of us. As we move forward, COVID-19 vaccines continue to remain a cornerstone of our plan to manage this virus. As of 8 a.m. tomorrow, February 18th, Ontario is expanding booster dose eligibility to youth aged 12 to 17. Appointments can be booked through the provincial booking system and Provincial Vaccine Contact Center, as well as pharmacies administering the Pfizer vaccine. À compter du vendredi, le 18 février à 8 heures, l'Ontario élargira l'admissibilité à la dose de rappel aux jeunes âgés de 12 à 17 ans. Il sera possible de prendre rendez-vous par l'entremise du système provincial de prise de rendez-vous de l'infocentre provincial pour la vaccination, ainsi que dans les pharmacies participantes qui administrent le vaccin Pfizer. Appointments can be booked for 6 months or 168 days after a second dose. Boosters are an effective means of reducing your likelihood of becoming seriously ill from COVID-19. There's also now good evidence that vaccination cuts your risk of developing long COVID syndrome in half. Even if you have had COVID in the past, getting vaccinated is still recommended as it provides better protection against future infection. And it's never too late to get vaccinated with your first, second, or booster dose. We have observed continued improvements and stabilization in key public health and health system indicators. The percent positivity continues to decrease, and new admissions to hospital and ICU have been declining week over week. There are also continued decreases in the number of outbreaks in high-risk settings, such as hospitals and long-term care homes. Once again, I want to thank Ontarians for their incredible sacrifices. Your collective efforts have allowed us to get back to where we are today. Our plan to get here has always been data-driven, and the decisions that we make will continue to be based on the best science and evidence. The risk remains, and we must remain nimble in our response and be ready to respond to new risks in a manner that minimizes severe outcomes and impacts on our health system while limiting any further disruption of every person's daily lives. Thank you. Merci.
Go to the phone lines for questions. Just a reminder, it's one question, one follow-up. Over to the first question, please.
Your first question comes from Richard Southern with City News 680. Please go ahead.
Hi, Dr. Moore. Thanks for taking my question. Doctor, aside from yourself, Ontarians have turned to the Premier for advice on what to do during the pandemic. This past Tuesday, the Premier suggested there was little value in further rounds of vaccination. Without pointing out that it reduced hospitalizations, the Premier said, quote, "We also know that it doesn't matter if you have 1 shot or 10 shots, you can still catch COVID-19. Doctor, do you think that comment was appropriate coming from the Premier?
Well, I can understand his concern, and it's about the protection of the vaccine against transmission, and it has been excellent against all the original strains of COVID, so alpha, beta, gamma, delta. It's less effective against Omicron, against transmission. The good news is for this vaccine that the protection is excellent against severe outcomes, and I think that is what really needs to get highlighted. A third dose is over 90% effective against admission to hospital, admission to the intensive care unit, and or death. 2 doses is still excellent, but 3 doses are better. 2 doses is around 80% effective against severe outcomes, hospitalization, ICU, and death. So I think that's the story that really needs to get told. Yes, the vaccine with 3 doses is around 60% protective against getting symptomatic COVID-19 disease, but it's excellent against the severe outcomes.
Follow-up.
As we begin to loosen some restrictions today, we're learning that wastewater analysis shows that the reduction in cases has plateaued. Can you speak to that, and does that give you any concern right now, Doctor?
No, I think that's excellent news. If you look at the epidemic curve of that data, it really shows we've reached our peak several weeks ago, and that correlates to our rise in admissions to hospital, which peaked in the 3rd week of January, and they've been coming down ever since. So yes, they're plateauing, but they're plateauing at a very low level, and hence I do think that the peak in risk and peak in activity of Omicron is behind us. There remains a risk. There remains a risk of transmission every day, and hence the need to continue to wear our masks at present, but we'll review the evidence of when we can further reduce that public health measure of masking in public spaces, and everyone should make a risk assessment, especially if you're vulnerable to this virus, if you're elderly or immune suppressed. Please continue to come forward and get vaccinated, as it protects against all the severe outcomes. But I think the worst is behind us, but there is an ongoing risk. I don't think, and I've had conversations with those experts from the science table, we'll have a significant rebound in activity or impact on our healthcare system. I do think the worst is behind us.
Next question.
Your next question comes from Charlie Pinkerton with Queen's Park Briefing. Please go ahead.
Hi, good afternoon, Dr. Moore. As part of the government's plan to end its mandatory proof of vaccination system on March the 1st, I'm of the understanding that the vaccine mandates and soft vaccine mandates for other professions will continue. Have you begun thinking about when these should be ended? And if so, could you sort of explain where you currently stand on these requirements?
Well, thanks very much for that question. Yes, we're reviewing all directives and letters of instruction that we've put in place across multiple sectors in Ontario. We do think the highest risk is behind us, that we're heading into a lower risk environment, and that the need for vaccination policies across Ontario sectors, whether it's health or in colleges and universities, is no longer necessary. So we've started those conversations just in the last couple of days of when we will remove the immunization policy requirement for colleges and universities, for other workplace settings, as well as in the healthcare system. I do think we should align their removal with the removal at a population level, so on March 1st. That may be early for some organizations, but that's my goal, is to have those immunization policies removed by the 1st. They have done their intended purpose, was to improve immunization, to further protect Ontarians. I thank all Ontarians that have come forward to get vaccinated, but they have served their purpose to protect us, and as any public health measure, they have to be removed in a timely manner.
Follow-up.
Yeah, so am I following you correctly then that these other, again, when I'd asked about the other vaccine mandates for professions, essentially, that they could be gone as soon as March 1st? And then just on top of that, various public health measures have come and gone during the pandemic, of course. Once the proof of vaccination system goes away, being likely the most significant, or one of the most significant measures brought to date by the government, do you ever see yourself recommending it return, or is that it for this system?
So I just want to make sure we're on the same page. We have not mandated immunizations. We have mandated that organizations have immunization policies. So that's typically get immunized, get educated regarding the benefits and risks of the vaccine, and or have a testing strategy. So that that mandate to have an immunization policy will, it's my intent, together with negotiation with partners, to have them removed by March 1st. And I think that's prudent. It follows the removal of proof of immunization for other venues. So I think it's timely to remove them for businesses. There may be mandates by organizations that are not government that would want to have a testing strategy continue, especially if they have a high risk setting. And I'll just also be particular that there was a mandate for vaccination in long-term care facilities by the minister. That is separate, as it wasn't a directive by the Chief Medical Officer Health Office.
Next question.
Your next question comes from Holly Mackenzie-Suter with the Canadian Press. Please go ahead.
Hi, Dr. Moore. I wanted to talk about the pace of the reopening plan. The latest version had 21 days between each step, and you've said repeatedly that's a good and cautious way to monitor the impacts of each step. But now we're less than 2 weeks away before all capacity limits and the vaccine certificates end. We're not going to have that much time to monitor the impacts of the changes today. So could you just explain what the rush is with this, especially looking at the wastewater data?
Wastewater data has come down significantly. So we are now, if you recall, we put public health measures in on January 5th. We then opened schools on the 17th, so there was roughly 12-day separation. We then further opened the economy again on the 31st, so another 2-week separation. We then made a 17-day separation. So we're always following the data and the science. I'm just so pleased that our hospitalization rates are coming down very rapidly. They went up rapidly, and now they're coming down in a very quick descent. And remembering hospitalization is a later signal. So I do think the risk is less at a population level. I do think the worst is behind us. And I think following the data, any public health measure should be as short as possible. It limits people's freedoms and rights, and we have to be responsive to that and the implications of public health measures. So we've always said that they should be proportionate to the risk and balanced in their response, and I think shortening it by 3 to 4 days this time from the 21st to the 17th was reasonable, and because we're having such a rapid descent. And I do anticipate that we won't have any significant rebound in risk to hospitalization, that we can continue at a 2-week march to March 1st to open up more broadly.
Follow-up?
Yeah, I'm just wondering as well about, last year we lifted restrictions at around this time with a plan to not enforce them province-wide again, and then in a couple months we had a hard lockdown basically in April because of the pressures on the health system. And I know you've said, we have vaccines now, things are different, but what's the plan in the event that there is a new variant that strains the health system again? Like, the unexpected can happen, as we know. So what is the backup plan? Would restrictions ever be brought back, or are we looking regionally, or kind of what, could you just explain more the thinking of kind of if things don't go the way we want or these trends don't continue?
Well, I am optimistic that we're on the right path, and want to thank all Ontarians for the sacrifices they've made. You're absolutely right. We're in a much better position now, with 90% of our 12 and up population having had at least 2 doses, 6.7 million Ontarians having had 3 doses, and now having wide availability of other therapeutics, including outpatient oral treatments. Much better position now. I absolutely don't want to have to go back and impose any public health measures. You're basically asking, are we ready if there's a new variant? We've got a very robust surveillance system. We can expand our PCR testing capacity if necessary to try to deal with a new strain or variant. We've got plenty of public health experience and health system infrastructure now in place, more ICU beds, more treatment options for patients. So I think we're in a much better position now. I also think internationally, we have more people immunized at an international level. We still have a long ways to go. At least 40% more of the global population should get access to vaccines, and that's an international effort. Once we get that, the risk of new variants emerging should decrease. But we have a robust surveillance system, both provincially and nationally. I trust our Public Health Agency of Canada to be monitoring the international scene as well for any new variants, and to be able to put in travel restrictions if and when necessary. We've learned plenty in the last 2 years of how to reduce the risk, and I think the science behind this is much better than we've ever had.
Last question, unless someone else joins the queue.
Your next question comes from Jeff Gray with the Globe and Mail. Please go ahead.
Oh, hi, Dr. Moore. I just wanted to ask about the timeline for lifting masks. You've mentioned, I guess, the 2-week period between restrictions that when they're lifted and so on, to see for the impacts. I think you've mentioned also a possible level of a rate of 10 per 100,000 in infections. Is there a criteria on when you would look at lifting masks, and would you do it across the board, or would we leave them in schools and on transit and hospitals? Or can you talk a bit more about when that's coming and what it'll look like?
Well, thanks very much. It's a great question, Jeff, and we're actively working on that. We want to open up on the 17th and make sure that that's done safely. Further opening on the 1st and monitor the data as we've done in a phased, staged approach. It's worked well for us in Ontario. And 2 weeks after that, we review any other public health measures, including masking. If and when we transition, it would be from a mandate to mask to a recommendation to mask. I would certainly hope that vulnerable members of our community that are at risk for this virus, that are immune suppressed or transplant patients in public spaces, would continue to mask. And we may review masking for public spaces like and transport systems like subways, buses, etc., to ensure that everyone's confident to use those resources. So if you'll bear with us, we're going to follow the data, follow the evidence, and anticipate that we'll be reviewing masking in public on the 2nd to 3rd week of March, and make decisions for all public spaces, including schools, in that time frame.
Follow-up?
So schools and then malls and retail and so on, but it might possibly remain in certain settings even after that time?
It could. But we absolutely want to look at the risk at a population level and make sure that we're in a safe place across Ontario, across all regions, because this will be removing it for all Ontarians. And we know there are some regional differences. Even right now, in Omicron, activity is higher in the north and northeast. So but you have our assurance that we're going to review all measures, including masking, and we'll make the removal at a population level when it's the safest time for Ontarians, but ensure that those that are vulnerable feel confident to continue to wear them to best protect themselves. We all need a break from them, but reminding ourselves that we may need them again in the fall if Omicron comes back, and obviously all the other respiratory viruses are going to want to come back, given we haven't been exposed for many years against them.
Last question.
Your final question comes from Randy Rath with CHCH-TV. Please go ahead.
Yeah, hi, Doctor. I'm wondering if you're saying that the necessity for vaccine mandates in workplaces is gone on March 1st. Should people that were fired, that lost their employment because they refused to get a vaccination, should they be rehired?
Well, I would leave that up to the individual corporation. Our policy and recommendation was to have an immunization policy, whether you vaccinate or get tested. If they've gone forward and had a mandate, which was not our direction, I would leave it up to the individual corporation to negotiate that with their workforce.
Follow up, and this is the last question.
Would you, doctor, feel confident that an unvaccinated person could go and work in a long-term care facility now?
Well, it's a good question. I think we've improved the infection prevention and control practices significantly in long-term care. I think as we head to low endemicity and low-risk environments in that setting, we should absolutely review all measures that have been put in play. But infection prevention control practices, so masking and hand hygiene, all those practices that work so well before we have vaccine have to be monitored. You need good quality assurance that they're maintained and the workforce is educated in them, realize their benefit. And I think that's one of the biggest lessons learned from our long-term care activities is how to ensure ongoing sustained benefit of the baseline infection prevention control practices to best protect their clientele.
Thanks, everyone.